I'm glad to be here, and I can see lots of familiar faces and familiar names as well, including my mom, who's actually joined in all the way from Mumbai. So namaste. Uh, but without further ado, I'm going to start quite a simple presentation on COVID, and my focus is on what do we do in the community uh, as citizens and as members of the society. We have lots of patients who have COVID symptoms. They have got a positive test for COVID, and they are otherwise quite well, and so they don't need a hospital admission. But how do we manage them at home, and what can you do for yourself if you have COVID symptoms, or if one of your relatives or friends has COVID symptoms? And that's always been a bit of a dilemma. Now, we all know that the government advice has been changing quite regularly, and so it's hard to keep up with it. Even as doctors, it's very hard to keep up with the government advice. And you wouldn't believe it. I got my phone here. Just half an hour back, I got an email from NHS England, and they mentioned a change in the policy that I got to implement tomorrow. But having said that, I just wanted to start off with a very, very small story. I was at the local Asda shopping, doing some grocery shopping with my wife, and saw at least 5 people not wearing a mask. And I went, we are at the peak of the second wave, and what are they up to? Or why are they not wearing the mask? So I made a snide comment to my wife, and she said, Kunal, have you forgotten some principles of art of living? And that made me stop and think. And one of the principles is don't look for intention behind others' mistakes. And it just made me stop and think maybe they have a reason for not wearing a mask, or maybe they need further education and understanding of COVID. So with this background, if I share my screen, for the very short, simple presentation. If you can't see it because you're using a smartphone and so on, we can certainly email it to you or send you a link. Because I'm sharing the screen with you now. Raj, could you let me know if it's shared properly? If you can.
Yeah, it's fine.
Yeah.
Yeah, you can expand the screen.
Yeah.
Okay. Make it full screen.
Oh, okay, perfect. So that's great.
Yeah, that's perfect.
Okay, so I'm going to cover just 5 areas. And although we are very aware of the common symptoms of COVID and what to do, it's been almost a year, and sometimes some details tend to get missed, and we fall into not so good habits once in a while. So it's a good idea to recap them. So let me start off with the symptoms that we all need to be aware of. So the 3 very important symptoms are fever, a new cough, and as we all know about it, the loss of sense of smell and taste. There are some other symptoms that we can get, and they are a bit more vague as well. So shortness of breath, feeling tired, generalized body aches, headaches, and sore throat. And lots of patients have mentioned diarrhea as well. So just going into a little bit more detail, fever. So if you don't have a thermometer, you can just have a feel. If you're hot to touch, you're feeling hot and cold, shivery. If you do have a thermometer, the temperature 38 degrees, or what the UK government says 37.8 degrees or more, would classify as a pyrexia. So nowadays you can buy these thermometers online at various pharmacies, and they cost between £20, £25 now. So it's always a good idea in this COVID era to have one at home. The next symptom, which sometimes is very unclear, is cough. And so what happens in a COVID cough? So it's a new cough or a cough that has worsened. If you've been coughing for continuously on and off for an hour, that would classify as a new or a worsened cough. Or if you have 3 shortish episodes of coughing in a day, that would still be counted as a new or a worsened cough. So the COVID cough, just to get an idea, is typically a very dry cough. quite an irritating one. If I could mimic it, it would sound something like, and I just can't stop it because it's as if something's irritating there in my throat. So something to be aware of. Yeah. So some people can lose the sensation of taste or smell and smell. Sometimes they can taste things a little bit differently, and they may say, "Oh, this curry that you cooked, it just tastes very, very different. Yeah, it's very unusual." And yeah, that's something to just keep at the back of the mind as well. And along with this cluster, you do get these other symptoms that I mentioned as well, which are very, which kind of merge with symptoms of the flu, which again is very common at this time of the year. So that's the body ache, sore throat, myalgia, body aches and so on. So moving on. So if you have these symptoms, we need to take the next steps, isolate ourselves, get a test done. But just going back a little bit, and this is more of a recap of what we know. But sometimes, as I said before, we can get into bad habits. So at the moment, we are at the peak of the second wave. And the lessons learned from the past, so Spanish flu about 100 years back, the second wave was very, very tall. So we had to be very careful in the next couple of months and take extra precautions. So we stay 6 feet apart or 2 meters apart or 2 arm length apart from other people as much as is possible. I'm sure we're all noticing that people are kind of getting a little bit blasé about it, a bit complacent here and there. But this is the time, the next few months, we've got to be very careful. Again, common sense when we cover, we've got to cover our face when we cough or sneeze. Make sure we wear masks in public, cover the nose as well. And try not to touch your mouth, face all the time because we are kind of transferring bugs. And then again, at the same time, be very careful, and regimented about hand hygiene. So just moving on, close contact. You hear the government mentioning all these guidelines, close contact, avoid this, avoid that. So what does it mean exactly? So we can easily divide it into 3 types. So one is if you are within 1 meter distance, even if you're wearing a mask, face-to-face contact with someone, even for a short time, even if you say, hello, how are you? Just a very short half-a-minute conversation, or if someone coughs or sneezes in your face, that is your close contact. Say, for example, you're giving a ride to someone and they're sitting in the back seat, but obviously you're sitting in there for more than 15 minutes. So that's a distance 1 to 2 meters. That would again be classified as a close contact. And the third category is people who come into our house. So here I'm not referring to the bubble or our close ones who help us out, because they would naturally go into a close contact. But people who spend more time, cleaners, cooks, if you've got nannies or babysitters, helping you out, all these would fall into the close contact category. So moving on, the other confusing term is self-isolation. Current guidance has changed to 10 days from 14 days, so do bear that in mind. So when would you self-isolate? Okay, so if you or someone you live with have symptoms of COVID, or if they have a positive COVID test, then you must self-isolate 10 days. Yeah. Someone in his support bubble. So, for example, my in-laws are in my support bubble. They live close by. So if I've been in close contact with them within 40 to 48 hours of them having symptoms or a positive COVID test, then I would need to self-isolate. Now, sometimes we go to a restaurant, we are shopping, but we have used a test and trace app. And that's how the government keep tabs on what's happening in the community. And are there people with positive tests going about out and about shopping and spreading the virus? And that's why if you are using the test and trace app, which I strongly recommend you should, then you may get a message that it's likely that you may have been exposed. It's very, very important in that case that you do isolate. And finally, just to complete the list is, if you arrived from a country with a high coronavirus risk, then you must self-isolate as per the guidance. Now, the other thing that we keep on hearing is the risk groups, and people do worry, which is very natural here. Are you in a high risk? Are you in a moderate risk? And there are long lists of categories mentioned, patients with people with different conditions who fall into different groups. But just to give a couple of very obvious examples, so high risk patients are people are the ones your GP and the government would contact you. And these are people who have an organ transplant and they're on strong immunosuppressants. If you have got severe COPD, end-stage kidney disease, you're on dialysis, or you're having ongoing cancer treatment, not past cancer treatment. And then there's the moderate risk where you are still vulnerable. And that's people who are over the age of 70, if you're obese, if you've got diabetes, COPD, and so on. So what does that mean? What it means basically is you need to be extra careful. The one in high risk need to be extremely, extremely careful. And this was a group that was shielded when, during the peak of the first wave. Okay. So what I'll do is you can feel free to post or text questions to Raj, and some of you already have done them, and he's passed on a few questions to me already. And then I can take them at the end of this book. But moving on, it's management and community. So if you're very unwell, you call 111 or 999, and they may whisk you to hospital, and then you're managed by the hospital team. But what happens if you have a positive test, you have symptoms, or one of your friends or relatives have symptoms, and you are at home? You have called 111, and you've been advised things are stable, you don't need to come to hospital, but you need to take care at home. And sometimes the advice may be a bit vague or unclear. Let us know if you're feeling worse. Let us know if you get short of breath. So what can you do in the meantime? So the most important thing is stay at home. I've had patients who have confessed to me that they have been out shopping at your local Asda, Tesco's, because they haven't had enough help and they needed to get out and so on. But the very important thing is if you don't stay at home, you're passing the virus or very likely to pass it on to someone else. As far as possible, apart from your bubble, avoid visitors. Again, they would just pass on, take infection from you and pass it on. Yeah. Now, do bear in mind that very important days are day 5 to day 10 of the onset of your symptoms. It is during that time we have noticed that people do deteriorate, they get worse, and they need hospital admissions, sometimes ITU admissions. So if you're feeling okay, day 5 to day 10, make sure that you keep a close eye on things. And I'll come to that now. So what can you do? So there are a few home observations that you can do yourself and a few tests that you can do. And I'll describe a test called as 40 steps test that you could do at home as well. And that will give you a good idea of how you can manage, how you can pick when things are not going well and not delay asking for help. So just 3 simple things: checking your temperature, blood pressure, and I mentioned pulse oximetry, which is basically measuring your oxygen levels. Now, each of these instruments, if you had to buy them, costs about 15 to 25 pounds. So you do end up spending 75 to 80 pounds. So people can share them, and your GP can loan them out to you as well. So at my practice, we've kind of acquired about 50 sets of these, and we do loan them out to patients and then ask them to return them after a couple of weeks. So if you're not able to get them, then you can always call your GP and ask them if they can help you out. So I've shown you the usual temperature monitor. So thanks to Amazon, we can get good reviews as well nowadays. Fairly easy to know which one to buy. The one that I use for patients and I bought for myself is for blood pressure is the Omron basic one. Costs about 20 to 25 pounds, and it gives you a blood pressure reading, systolic and diastolic, so the higher reading, lower reading. It also gives you a heart rate. So we don't like the heart rate to be more than 100. Okay, anything between 60 to 100 is good. And finally, then we got the pulse oximeter, which helps to measure the oxygen saturation. It's very easy to use. Just press there, switch it on. And I just pop my finger in there, and it will take a reading. So soon we'll know what my oxygen levels are. So it's not too bad. So 99% is good. Normal oxygen levels are 95 or above. So what we could hope for, Raj, is maybe at a later stage, for the locality, we could try to acquire maybe a couple, and if someone is in need of them and can't purchase them, then we could maybe loan them out as well. And then coming to 40 steps test. So what typically happens is you get the typical symptoms of a very, very bad flu, and you're tired, exhausted. I don't feel like eating, drinking, but there's something called a silent hypoxia, which means people don't get very short of breath, but at the same time their oxygen levels drop, and then they can crash fairly quickly. So to monitor for silent hypoxia, we recommend checking your oxygen levels. I would say at least a couple of times a day. Even if you're feeling okay, check them. So there's something called as a 40 steps test, and it's fairly easy to do. This is a change from a sit and stand test for 1 minute, where you are asked to sit and stand as fast as you can for 1 minute, and then check your oxygen levels, so before and after. Older people, it's harder to do. If you've got arthritis, it's harder to do. So it was kind of modified into a 40 steps test, where you check your oxygen levels before you start. They should be more than 95 or more than 95%. And then you walk for 40 steps on a level ground, and you recheck the oxygen levels. If they drop by 3% or more, say if mine was say 96, but less than 90, it should be less than 95. So if they drop from 97 to 94, 96 to 93 or more, then that means that my body is struggling to cope under stress. And it's very important at that stage that you should dial 111 and mention this is what's happened. Very likely than not, they would ask you to be examined, to come to the local center. So the next burning topic is the vaccination. So I thought I could quickly cover that as well. So as we speak, the second vaccine has been approved, and that's the Oxford AstraZeneca vaccine. We've all heard of the Pfizer vaccine, and they are in some way similar, but from a doctor's point of view and from a vaccinator's point of view, they're very different, because one is stored at -70 degrees Celsius, other one can be stored at 2 to 8 degrees Celsius, which is the Oxford vaccine. Neither of them contain any animal products or eggs. If you're a vegetarian, or if you've got specific religious beliefs, if you don't eat beef, pork, then it's still fine to have them. At the moment, they are not licensed under the age of 16 to 18, depending on which vaccine you take. The recent change just the last couple of days before the weekend was you could take them even if you're pregnant or breastfeeding, but we want to weigh the risks and benefits before we offer that. Okay, the vaccine will not make you COVID, give you the COVID illness, or you can't pass it on to your little one. So who can have it? The government has divided the people into different demographics into cohort 1 to 9. And the cohort 1 is the one that we've approached already, and that's people aged 80 or over, those who work in care homes and those who are residents in care homes, because they're at the highest risk, and healthcare workers who are at the highest risk. So doctors who are working in hospitals with patients, anesthetists and ITU doctors and so on, and nurses. So they would get them in the first wave of vaccination. So how do we give it? Fairly straightforward. So I have had my COVID vaccine just before this, on the 31st of December, and it's given straight into the arm. It doesn't hurt at all. And we aim to give 2 doses, 3 weeks to 3 months apart, depending on how the government can procure them. So just half an hour before I was going to do this presentation, I got an email from NHS England, and they said that they are trying to get as many people as they can have the first vaccine, and they asked us to try to give the first dose to as many people as we can manage, and then do the second dose, not at 3 weeks, but you could do it a little bit later. So the general understanding from the research that's available to us is that after the first dose, it's 70% effective. After the second dose, 90% effective, which is quite good. And the next, again, burning question, side effects. So you do get soreness, a bit like having the flu vaccine or the tetanus vaccine for about a day in your arm. People have reported mild fever, headaches, body aches, tiredness, but nothing more than that, similar to what you would get if you had the flu jab. And this slide is just to show what the government is doing at the moment. So in UK, we got the Pfizer vaccine and the Oxford vaccine. The Oxford vaccine is on its way, and the government has made an order for about 40 million Pfizer vaccine and 100 million Oxford vaccines for the moment. So we got our ears to the ground and see how it goes. And then moving on to just from a holistic point of view, I wanted to mention the Ayurvedic approach to this as well. I'm not an Ayurvedic doctor, so I have to give a bit of a disclaimer that this is ongoing research, not approved by the NHS at the moment. But I can't see any harm if you do what's recommended. So moving on to diet. So again, common sense, plenty of fluids, avoid foods that's hard to digest, like red meat, fatty foods. What Ayurveda recommends is having healthy or turmeric juice. Allopathic research has shown that it does contain quite a few anti-inflammatory agents. And I think in a few years' time, it probably will climb up the ranks in treatments. But it's something that you can certainly include in your diet. Tulsi or basil leaves or basil juice, again, something that we can easily add to a diet, can't do any harm. And Indian gooseberry, basically because it's got high vitamin C content, and vitamin C can help us fight infections. I'm sure we all know about that. What I would like to add to this is vitamin D. It's very dark outside. I think it's just past 6 at the moment, and we don't get enough sun. What I tend to do, September to March, I tend take vitamin D supplements without bothering to check my vitamin D levels. I know they're going to plummet this time of the year. So not just for COVID, but just as a routine habit, I would say, especially if you're living in a country where there is a lack of sunlight, September to March, just make it a habit and take vitamin D supplements. And then there are a few yogic practices that have been recommended by Art of Living Ayurveda. So one is Nadi Shodhan, which is alternate nostril breathing. So those who do yogic practices may be aware of this. Kapalbhati is again a type of breathing that helps to clear out the lungs. Again, I can't see any harm doing them at all. Sudarshan Kriya for those who are into Art of Living. I'm sure you all experience benefits of it. Again, what I would probably say here is if you have the COVID symptoms, you may find a few things difficult. So if you are going to do the Ujjayi breath, it may provoke a cough. So just be a bit gentle about it. Doing Bhastrika vigorously may make you short of breath. So you could just respond to your body. But there's again, I would recommend carrying on doing them. A very interesting one, which I came across and I was reading about it. There's some research early stages done on neti pot saline irrigation or gel neti. Some of you may be aware of it, some of you may not. And that's a practice which is used to clear out sinuses with saline solution. So something interesting of note would be the way the virus attaches and gets entry into the body is through receptors or their points of entry called ACE receptors, and they are present in very high amounts in the nose and in the lining of the sinuses. There's some thought that these receptors are very close to the nerve endings, although they are not a part of nerve endings, they are close to them. And because of inflammation of these receptors, you may get the loss of sense of smell. So there's some thought, there's early work done in doing saline irrigation. The evidence is not conclusive at the moment, I have to say, but again, it's something if you're doing it, might as well do it regularly. And then finally moving on to asanas. So Ayurveda recommends these 5 asanas to help boost your immunity. And I just put in pictures there. So you got the Kati Chakrasana, Trikonasana, Dhanurasana, or the bell pose. And then you got the bridge pose, or the Setu Bandhasana, and a little bit more complex standing Nataraja pose, or the Natarajasana. And these have been recommended by Ayurveda. And finally, just to recap, the tenets of the happiness course that many of you may have done. And I thought it was really interesting. I don't know if all of you had this handout that I prepared a few days back, but I just mentioned at the end, so we see people not wearing a mask, which is what I did, and I was just pulling my hair out, but I shouldn't have looked into what others I could educate and move on, but they may have their reasons for not doing it. Again, there's lots of myths about it as well. I heard some people actually say this is a big hoax, and I don't know why. If you think of the corporate world and the way they're suffering, they would not let such a hoax carry on. So this is very real. As I speak, my sister-in-law is admitted with COVID in hospital, and I've had lots of patients who have been admitted, come back, survived, and many of some have passed away as well. So this is something very, very real. And then another lockdown. When will this end? And the first sort of link principle was the present moment is inevitable, and we got to accept the situation and try our best. So that kind of concludes my presentation part. But I think Raj, you've been collecting some questions as well. So I could see if I can whiz through a few of them, and then we can move on to the next part of this.
Yes, we've had a lot of questions actually.
Oh, okay, that's great.
Yeah. So, so do you want to close the sharing of your screen?
Oh, yes. Yeah, of course. Yeah, sorry.
Yeah, so we can see everyone.
Yeah, that's great. Yeah.
Okay, that's brilliant. So let's just do the setting. Okay, so we've had a lot of questions from people. So I will start with some questions first of all, in the time that we have. So the first question is, there are so many different types of masks. Which one should I wear?
That's a really good question. I mean, I'm glad someone asked that question. And if I could, what I did was actually, I was expecting this one, and I've managed to collect a few masks that I have. So this one, which is a 3M mask, this is the one that the government gave to us to use for COVID patients. So if we have a possible COVID patient or someone with confirmed COVID who comes in the practice, and we are seeing them, we are wearing this. So it's a very uncomfortable mask. It's quite good, but we are wearing this because the risk is very high. You get masks with valves as well. The high quality ones are good. The cheap ones with valves, they protect you, but you just breathe out through the valve, and you're just breathing out into the other person right through the opening there. So I personally wouldn't recommend them. They cost more, but they don't protect others. So you are probably, if you got COVID, you're probably passing it on quite easily. So the mask that I tend to use when I go to work, I tend to use the simple one. I can get rid of it at the end of the day or after each patient if I'm seeing them face to face. If I'm just going out for a walk, just a 2-layered mask. and that's fine. And then I got another one as well, and they're washable. If you have cloth masks, perfectly fine. Most important thing is to make sure you cover your nose. And I think it's very silly. People wear masks and sometimes they just pull it down. Understandable. For months and months you've been wearing them. But if you think of it, the point of entry is through the nose. So if at all you have to do something, cover your nose. Right? Okay. But that's the thing about mask. If you're going out generally, wear a simple mask. That's perfectly fine. But make sure you cover your nose.
Next question. A friend of mine had COVID 4 months back and is still tired on excursion.
Okay.
What should he do?
All right. Okay. So that's quite interesting. So 4 months. So there's something called as long COVID syndrome or a post-COVID syndrome, where it's been noted that people who have had COVID, a small percentage of them have had COVID-like symptoms going on, not for a couple of weeks afterwards, but for more than 12 weeks or about 3 months. And these patients would be classed. So I think the one that you mentioned, Raj, or the one posting the question, possibly has long COVID syndrome. Now, interestingly, the government has put in a really good program for rehabilitation of these patients. You could go online and just type in long COVID syndrome or post-COVID syndrome, and it would come up with the government links where you have online rehabilitation access as well. If you do have underlying symptoms, then it would be useful to run it past your doctor over the phone, and they can just weigh the risks and possibly get you in to be examined, get some bloods done. But yeah, I think that patient possibly has long COVID syndrome.
Okay. What should I eat if I have COVID? Okay.
So again, common sense, same for most infections, and what's mentioned in the Ayurveda bit. So lots of fluids, healthy food. Try not to eat foods that are hard to digest, because then the body is focusing on other areas. You can also get diarrhea in COVID. So again, red meat, fatty foods, I would probably stay away from them. Other than that, stick to your usual diet.
Can I do Sudarshan Kriya of the Art of Living if I have COVID?
Okay, so I didn't mention that in the presentation. So you can definitely do Sudarshan Kriya. If you are feeling tired, then you may have to go a bit gentle on it, kind of be guided by your body.
Okay, now some of the vaccine questions. Can the vaccine be given to those who are pregnant or breastfeeding?
Okay, so that's again very interesting, because just 3 or 4 days back, the government, the guidance was changed. So before that, in 2020, the guidance was pregnant ladies breastfeeding, ladies who are breastfeeding should not have the vaccine. Now that more data has come out, the guidance has changed, and probably if you have been told previously you shouldn't have, you can have the vaccine. What we are trying to do is to weigh the risk and benefits. So if you are very low risk and you're comfortable staying at home isolating, then maybe you could avoid taking it. But say if you've got asthma or other underlying conditions, then definitely worth exploring that option. But it's now licensed.
Okay. Can children have the vaccine?
Children at the moment, unfortunately, can't. So one of the vaccines licensed from the age of 16, other ones from the age of 18. But as we speak, I think Pfizer and both AstraZeneca, they're conducting trials for younger age group, and I think they will come up with results in a few months' time. Having said that, children do get slightly milder illnesses, and thankfully there have been less morbidity and deaths in children.
When will the vaccine become effective after I receive it?
Okay. So most of the vaccines available at the moment, so Pfizer and Oxford, they're both two injections given at 3 to 12 weeks, depending on what the government advises us now. They would become effective. So what they say is 70% effective after the first injection in a couple of weeks' time after taking it, and more than 90% effective after you have the second jab, after about a week or so. So if you are looking at more than 90% effectiveness, which is 9 out of 10 people are protected, then I would say about a week after you had the second jab. Otherwise, about 70% effectiveness after a couple of weeks after the first one.
Okay. How long does the immunity last after 2 doses of vaccine?
Oh, that's an excellent question. So if you think of it, the vaccine has come out in the last few months, so they haven't had time to have long-term data. The current advice, again, is what they're saying is after 2 vaccinations, it will confer immunity for a few months, is what the companies advise. But they're also saying that you may need further vaccines after that. So a few months is what I would say at the moment. And what you're hoping for is that with this vaccination bit plus distancing, you would be able to, you kind of slay the dragon, as a title of the presentation.
Okay. What are the chances of me growing an extra arm after the vaccine?
Well, I've had the vaccine. I haven't had the extra arm growing as yet. You could probably have the second jab in the extra arm for the person asking the question. But jokes apart, I think the question lies in safety of the vaccine. Just getting there, serious. Then that's a really good question in that sense. So the vaccine is very safe. The fact that the companies and the government has given a go-ahead for pregnant women and breastfeeding women in the last few days kind of emphasizes that bit, that they are now more certain that it's safe. So I don't think you'll grow an extra arm. You probably will get a sore arm, but yeah.
Can I have the vaccine if I have heart problem, diabetes?
Oh God, yes, definitely. In fact, you must have the vaccine if you got heart problem, diabetes, and that's the cohort 1 and cohort 2 that we are targeting, because these are the people who have higher risk of getting severe COVID symptoms or decompensating if they get COVID.
Who can't have the vaccine?
Okay, so like I said, so till recently, pregnant ladies and breastfeeding, women breastfeeding, they weren't told to have the vaccine. Now they can. The one main group, which I hope, I think it may change again after a few weeks, is people who have very severe allergic reactions. So not a cough, not a rash or local reaction after a vaccine or after taking an antibiotic. But if you had anaphylaxis, as in you needed EpiPen, hospital admission, not going to A&E, walking down to A&E. So very, very severe allergic reaction, and you were discharged with an EpiPen or injection. So that's the main group. If you're on blood thinners such as warfarin, then we would want to know what your warfarin INR level is like. So those on warfarin, they probably know what I mean when I say INR. And if it is very high, then obviously you're injecting it and there's a risk of bleeding.
I get rash with antibiotics. Can I have the vaccine?
Okay, that kind of answers the question. Yeah, so if you just had a rash, you're fine to have the vaccine. There's no problem.
Are there animal products in the vaccine?
No. So Pfizer and Oxford have clarified that there's no animal products in the vaccine, and if you're a vegetarian or if you're a vegan, you could have it.
Do you see an end to the pandemic?
Yeah, I mean, there's definitely an end to it. I think the question is, do I see light at the end of the tunnel, and how close is that light at the end of the tunnel? Now, if you go back a little bit, or rather go back 100 years, Spanish flu lasted for 2 years, had 3 waves. Second wave was very high, and that's why I'm emphasizing we at the peak of the second wave, we got to be more careful. But they didn't have the vaccine. They didn't have those extra, all the developments that were there before now. So with the advent of vaccine, I think few months time, we should be able to curb it. Fingers crossed. Yeah, I would say a few months.
Yeah, so we've got a lot of questions coming in, so I'm doing my best to help everyone answer. Can we have the name for the temperature machine?
Okay, so the one that I've got here is some Braun. Yeah, Braun is a good one. BRAUN. If you can see there. BRAUN. that's fine. But you could buy the thermoscan. The thermoscan ones are the ones that don't go inside the ear, but you can just scan there. They were more expensive, but with so many people buying them, they have become cheaper now. So so at my practice, we bought thermoscan ones. So you don't stick them in there. You can scan it from 5 centimeters distance.
Okay. Is the vaccine mRNA vaccine that was banned in Europe and USA before COVID situation?
So the Pfizer vaccine is the mRNA vaccine, and that's interestingly produced in America. It's very safe, very effective. There are lots of I don't know, rumors about this vaccine. If I was worried, I wouldn't have taken it at all. I wouldn't have recommended it. It's a newish technology, but it's a technology that was developed, you wouldn't believe it, 12 to 15 years back when the SARS and MERS, when they were coming up. And what it involves is mRNA. Basically, if it gets into the cells, it'll help to produce a chain of protein, and that protein is unique to the coronavirus. So you're not producing lots of coronaviruses, you're just producing a little protein chain, and then the body produces antibodies against this protein chain. And then those antibodies will again work against, if you get infected with the virus, it will attack that same virus.
Yeah. Another question. Both my sons are asymptomatic COVID plus. I have no symptoms. I haven't tested myself yet. I don't see the point, as I could contract it after 10 days. Am I thinking right?
Okay. So the advice is, one, I mean, I don't know the background of the person asking the question, but if you're in the vulnerable group, you should, I don't know why you're not getting yourself tested. You must, if you're living in the same household, you must get yourself tested. If you're in the bubble, you must get yourself tested. I hope you're isolating, although you're asymptomatic. There's this thing called silent hypoxia, which I mentioned about. Yeah, unless you get tested, you wouldn't know.
Yeah, and so we have a lot of questions on the chat as well now.
Okay.
One of the first questions, apart from doing Sudarshan Kriya breathing techniques, should we be taking supplements, vitamins to boost the immune system?
Okay, so vitamin C, vitamin D, so D for Delta and vitamin C, these are the two I would recommend we should have. But other than that, a healthy diet is fine. If your diet is pizzas and burgers, then it's a different ballgame altogether. But generally, if you have healthy diet, then vitamin C, vitamin D, fine. Other supplements, what I tell patients is, if your diet is bad, maybe for 1 month in a year, you could take supplements just to kind of level out here, get your vitamin level sorted. But other than that, I wouldn't want you to waste your money.
I don't know whether I had COVID or not, but as per UK government, I'm classified as vulnerable as I had a chest infection 2012. Can I do 108 Surya Namaskars as I find myself okay?
If you can do them, that's great. I wish I could do 108 Surya Namaskars myself. You're probably super fit if you can do 108 Surya Namaskars.
Yeah. Then we have, if anyone is planning pregnancy, can she have a COVID vaccine? I think you've answered that question already.
Yeah. That's a recent change in guidance. So,
if a family with small children gets COVID, how to manage the small children? What is best practice?
That's very difficult. Now, small children, as in, the thing to remember with children is they generally, thankfully, touch wood, they are getting milder symptoms. But we do get a few cases where they go off, and when children go off, they go off very quickly. So although they are well, make sure that you keep a very close eye on them.
Yeah. Is it possible for a 2-year-old to pass it on to me?
Yeah, definitely. So the two groups, very interesting question now is of people who are spreading it is, one is children, because no fault of theirs. They are generally well, and thankfully they deal with COVID better than adults are dealing with. But when they go to school and they play, social distancing is not realistic. And the second group is Very interestingly, it's a group that we don't talk about much. Are the young teenage, not young teenagers, people, and youngsters going to university, and either it's hot young blood, I don't know, or they think that COVID doesn't exist or I can deal with it. But we we are seeing, I hope you won't mind me mentioning here, on this forum. But my colleagues who work in the sexual health clinics, they have noticed a massive rise in STIs or sexually transmitted infections in that group. And how would they get that, unless they were in, in close contact? And that's a group that, because of the nature of the infections, they will not be very conducive to contact tracing and so on. So that's a group that is also spreading them.
Yeah. How safe is supermarket visits?
The less the better. And the example that I gave was, there are people who have reasons and they don't wear masks. There are people who have COVID, they are COVID positive, and they still go out shopping. Now, can I just mention something? So the government has put this volunteer service and even financial help service. And in the little article that I wrote, I put in a link for that. So if you do have someone who needs help with shopping and so on, and they don't have a support system here, as in friends and relatives, they can ask for this kind of a formal help as well. But yeah, the question, you're going to supermarkets, I would keep it to the minimum. You can go if you need to buy milk, but masks, stay safe. That's the key.
Yeah. I have bronchitis. Am I high risk?
Now, it depends on how bad your bronchitis is. So if you're end stage, you would go into high risk. If you're not end stage, you would go into moderate risk.
Okay. So I've read out all those questions. We're running out of time now.
Okay.
Do you want to ask questions, or do you want to take questions?
Yes, please. Can I ask a question?
Yes, of course.
Because my husband's just today tested positive, and I've ordered the machine that you were talking about, and I just wanted some help on how to use it.
Okay.
So obviously I think he started showing symptoms 4 or 5 days ago, and he's just got a mild, just really tired and sleeping.
Right. So I'm sorry, I can't see the person.
You can't see me?
No. Can I show it to you on the machine that I've got?
No, I've got the machine. I just wanted to know how to use it.
So have you got the same one? Similar one?
It's not. I've ordered it. Yeah, I've ordered that from Amazon.
Oh, perfect. Okay. Amazon's great.
That's the one. Yeah.
So I switch it on. They're all similar, so don't worry about if it's a slightly different.
Okay.
One. So once it's switched on, you just press on the other side so it opens up.
Yeah.
Pop my finger in.
Okay.
And sorry, it just switched off while I was doing. Switch on, and then it takes a few seconds. I'll just see. Okay, so now you can see. So it gives the oxygen levels 98% and the heart rate 88 per minute, which is quite handy because, like I mentioned before, if the heart rate starts climbing up, then we do want to know that.
Can Ayurvedic medicines be used by transplant patients?
It's kind of beyond my remit, I have to say. Yeah, I'm not an Ayurvedic doctor. It depends on what transplant. What I can say is that there are some, I wouldn't say Ayurvedic, but in general herbal medicines, and there's something called, say, black cohosh that we are actually taught about or told to be aware of as allopathic doctors, and black cohosh can affect the liver. So it's a difficult one for me to answer. I would probably want to look into the ingredients in the in the preparation and know what transplant was there, what the patient had, and then look into it in more detail.
Okay, and I have a question. Somebody saying I'm early diabetic. Am I classed as vulnerable?
If that's the only, again, there's two things. If you're early diabetic, you won't be vulnerable. You won't be high risk, definitely. But if you're BAME, so Black, Asian, minority ethnics, or if you have got a very high BMI. If you've got 2 or 3 other conditions to go with it, then you would climb up here, up the ranks, unfortunately.
Okay. Do we have time, doctor? People are asking, keep getting questions.
I don't mind at all. I mean, I've kind of saved.
Yeah. Okay. So go one more. One other question is: can we go to the gyms which are currently open if one follows all the precautions?
Yeah, definitely. So I've been going to gym when Birmingham was in tier 3, and yeah, I took all the precautions right till the point I went on the treadmill. I kept my mask on, took it off, wiped everything down before and after, and that's perfectly fine.
Do you think closing schools is a necessary measure at the moment? Someone is asking.
Yeah. So what the government does, I think you may have heard of this concept called the R number. And what the R number basically means in a very simple way is how quickly is the infection spreading in that area or in the community. So if that's the level of social distancing in the people, if the R number goes up, the government wants us to move apart. If the R number is slow, then it's okay to kind of meet up in groups and so on. When you go into tier 3, tier 4, it kind of means that the R number is climbing up. The question about schools is children, as I mentioned earlier, they can be asymptomatic carriers. And that's the reason why the government suggests school closures and so on. Having said that, it's very easy to just sit and then say, okay, it's fine. And I do understand the impact of school closures. And I've got a little one. If her school shuts down, I'm in big trouble because my wife is a doctor. She's working all day. I tend to work almost 8 to 8 every day nowadays. And I don't know how I'll get childcare. So it's very difficult, but I hope the government has given enough thought to it when they make these decisions.
Okay, so we can take one more question because we actually are running out of time already.
Can I just ask one question, please, Raj?
Go ahead, just one more question.
I haven't got, it's not bronchitis I've got bronchiectasis, which is damaged bronchus to the lungs. Am I at risk? Am I high risk?
I think bronchiectasis would, if I'm not mistaken, would definitely put in moderate risk, and I think you'll go into high risk, especially if you have had recent hospital admissions as well.
Yeah. Okay.
But you would get a letter from the government and from your GP, a message from the GP saying that you are in high risk, and these are the ones that we targeted first.
I didn't get one. I didn't get a letter.
If you didn't get a letter, it would mean that the government has looked at the severity of your bronchiectasis and brought you down into moderate risk, which, if you think of it, is actually good news for you, because what happens is, when as GPs, when we put in notes and we put in a diagnosis, all that data is stored virtually, and the government has access to all that data, and they are extracting that data centrally and doing their own research and coming up with with these kind of
Thank you.
But if you have been told very clearly that you're not high risk, then I would say that's good news, because they have looked at your severity of your bronchiectasis.
Yeah. Okay. Thank you.
Okay, everybody. Thank you, Dr. Kunal. So,
I think it's a pleasure.
So, that's been extremely informative, getting messages on my phone as well as on the chat. It's highly informative. Thank you so much, Dr. Kunal. And I'm just saying that on behalf of everybody. I'm sure everybody has really benefited from the information from doctor, and also, from a yoga point of view and a practitioner. So let